So women constitute 51% of the population, and we must celebrate the efforts by SonoScape and other healthcare providers to improve women's health and improve the lives of our infants. Two important innovations that have developed over the last few years. As a specialist in maternal fetal medicine, I believe that ultrasound can play a major role in improving pregnancy outcomes and reducing perinatal mortality and morbidity. So two key innovations that have occurred over the last few years, which include the focus on point-of-care ultrasound and the use of artificial intelligence. So I really believe that the use of point-of-care ultrasound can help us to reach to women who are difficult to access the healthcare systems, particularly in the community or in low and middle-income countries. And therefore, the use of point-of-care ultrasound to improve the way we deliver the antenatal care has potentially huge impact on improving pregnancy outcomes and reducing perinatal mortality and maternal mortality. The other thing is artificial intelligence, which certainly over the last few years has proven to likely to be very beneficial in the way we deliver our antenatal care, and particularly combining artificial intelligence with the use of ultrasound and improving the imaging, the quality, but also trying to reduce the workload and the sonographers and obstetricians. So over the next few years, my prediction is that artificial intelligence will change the way we practice and the way we look after our pregnancies. I think artificial intelligence can be integrated in various algorithms, whether actually in the machine itself, whether the imaging, whether the way we help the sonographer to deliver better quality ultrasound, but also to have a systematic examination. So having almost a list or a checklist where you ensure that you don't miss any systems, but also trying to combine imaging modalities, whether ultrasound and MRI. And we must again celebrate the fact that the various healthcare providers, various ultrasound companies are actually looking at the use of artificial intelligence and how they can improve the quality of the ultrasounds that they offer. The publication of the ISUOG guidelines on neurosonography, so the two parts, part one focus on screening, part two focus on targeted neurosonography, represent milestones in improving our ability to detect brain abnormalities during a pregnancy. But I believe that it's not enough just to publish the guidelines. It's our role to ensure the training and the education and the implementation of these guidelines. And therefore, one important step in this pathway that ultimately you want to improve your ability to detect brain abnormalities during the pregnancy is actually to train the healthcare professionals and to disseminate the knowledge and to translate this guideline into a really easy, practical way of how you perform neurosonography to a high level, how you have a standardized views, how you can use your screening planes efficiently, and how can you actually use the targeted neurosonography to improve your ability to identify additional brain abnormalities. How would you refine your counseling and your prognosis so they can help your parents to make their decisions. And therefore, in my lecture today, I tried really to make it really simple, to make it very clinical, very practical, reaching out to all healthcare professionals, both the sonographers and the fetal medicine specialists, on how you can perform screening neurosonography to a high level, what the indications for targeted neurosonography, if you are going to do targeted neurosonography, what are the planes that you should look at, and what abnormalities that you could actually see while you're doing this assessment. Yeah. So if you perform only the screening examination, you're only able to detect up to maybe 80% of brain abnormalities during the pregnancy. What we really should aim is to increase that to more than 90%. And in order to do that, you need to train and educate the healthcare professionals how to improve their ability to identify, diagnose, and counsel the parents.
Okay, actually, all of us are aiming to deal with the woman to improve her health and the outcome. All of this will have a good impact on our life and also will decrease the cost of neonatal admission. So in this case, during antenatal period, we need to a good images, a good diagnosis to manage the fetus intrauteri, to manage the woman herself during pregnancy to reach our aim. Through that, we need ultrasound machines to be able to help us in the detection of abnormalities in the form of high resolution, good softwares for detection of any anomalies, especially in fetal heart, because the most common congenital malformation is fetal heart. And actually, by using the machines in different companies, they try to improve the software of cardiac anomalies assessment. And actually, the last version of SonoScape machines already deliver this data for us. Plus, they add another fantastic software, which is the artificial intelligence, AI. Through AI, we can choose the actual and the perfect images of the fetus in short time. Sometimes during moving of the fetus, we subject or we face a lot of problems to do freeze and to return it back, and we miss some images. But the good points in AI in the machines to do fast and early detection of any good images and facilitate us for evaluation of this image. Another software which is very important is that I liked it very much, which is what's called infusion software in the form of using the MRI in different system, which is difficult to use MRI during pregnancy because, as you know, the fetus is active, especially in the second trimester, so we cannot examine well by MRI, and also the machine of the MRI and the long time for getting the images is time consuming. But here we have already normal software of MRI, and we can compare our ultrasound image with MRI, so we can detect early and fast the abnormalities to help us to get the final diagnosis and advice and counseling the parents. Actually, my collaboration with SonoScape started since 2015 when they support me through their distributor in the annual conference of Egyptian Fetal Medicine Foundation. And after that, when they saw the level of the conference, one of their stakeholders who was a global marketing arranged a meeting with me. We discussed that our aim is the same. SonoScape aim to improve the knowledge and the training and skills of the doctors, and in this situation they will get a good benefit from their machines. And from that point, they started to support any educational or learning workshop, courses, event, symposium, all of these by themselves or by through the distributor. And after that, the support increased to be not only in Egypt but also in the region, in many of countries in Africa and the Middle East, like Libya, Sudan, Saudi Arabia, and so on. As regard my private clinics, I also have 2 machines, and now I have the high-end machine. Actually, this machines is one of the main machines in my private clinic, and for 3 years. Actually, and honestly, there's no problem. The software, usually they supply me by updated software. If there is any suggestion from me about the technology or to improve anything, they respond to me and reply. And at the end, a lot of points that I discussed with them, I need to improve in the machines to facilitate our work. And I found it in the new softwares, especially in the last version, which is S80 Elite. Perfect question. Actually, urinary tract abnormalities consider the third most common abnormalities in our region. The second point, it is difficult because there are a lot of diseases mostly similar, so we need to differentiate between them. High resolution machine, number 1. Number 2, high color Doppler to use it in assessing the blood velocity and the Doppler velocity. Number 3, 3D, because usually a lot of diseases associated with decrease of amniotic fluid, because amniotic fluid is its source is from the kidney. When there is abnormalities in the kidney, it affects the amniotic fluid, decreasing amniotic fluid around the fetus, leading to bad resolution. We cannot detect the kidneys well, so we need high resolution. We need 3D, good 3D for assessing, multi-slice 3D for assessing the kidneys and the ureters to differentiate between the anomalies. Actually, you asked me a very important question for me, because I joined ISUOG since 2013, and SonoScape in this period was not sponsored in any event of the ISUOG. until in 2019 when the president of the ISUOG joined our annual conference in Egypt, Egyptian Fitness Foundation, and after that the ISUOG symposium, the SonoScape decided to join this mega international conference, and they discussed with the president of the ISUOG and started to be one of the sponsors. I'm impressed this year because you are the main sponsor of the conference. You already deliver elite like your machines, elite venue, well organization, very good hospitality and support for the doctors. The scientific office choose will trainer and speaker in the ISUOG and all over the world to join your scientific program. I'm impressed about the attendees, the number of attendees, more than 20 doctors to join industry scientific event. Fantastic. I think it is the biggest number in all the sponsor companies. So I'm very happy for what happened and what SonoScape reached with us as ISUOG or our region, Egyptian Fitness Foundation. And I hope to continue and to give us more and more from your support, because all of us need this kind of mentality, this kind of R&D and your support.
You know, everyone is aware that AI was initiated by SonoScape, and in that direction, I am excited as to what else can SonoScape give in the next few months or years. So my expectations are that it may probably increase the congenital anomaly screening features, plus in gynecology, all the volume acquisition, wherein you can probably see the endometrial pathology or the ovarian pathology. That in itself is an AI accumulation of any ovarian and endometrial pathology in gynecology. And that would help every OBGYN internationally. Do you realize that in my country, the Philippines, is a middle income country, and there are a lot of economically deprived women, and with the cost effectiveness of your machine, the SonoScape, it will help a lot the women from the suburbs and all the women in the Philippines, and also the OBGYN practitioners, to give comprehensive help to those women. And with the evolution of AI, for those obstetricians who are so busy, it is going to be ergonomically good. And for us who are doing all the clinical applications every second of our lives, it will really be a very good help for AI features in SonoScape. I know for a fact that in the next few months or years, is going to be an AI solutions for every OBGYN practitioner. And I am very excited. I am not really afraid with those AI technology. I embrace them with all the possibility of a progressive obstetrician gynecologist. So when we talk about AI, I think the very idea that SonoScape is giving out a lot of programs and innovations as well as education, it will help and clear all the OBGYN sonologists internationally. So that alone, if you proceed with a lot of programs, a lot of workshops wherein we can understand AI, then everybody will be in this field helping all women worldwide. Yes, it is very appealing, it is very beneficial, and in fact, it is very comprehensive, and somehow you feel you belong. Like in any ordinary situation, obstetrician gynecologists would love to belong. We would love to understand, we would love to learn, we would love to be involved in certain clubs. So these are facts which are very important for social and mental health for every obstetrician gynecologist. And so for that, I commend you for doing this. SonoScape, unlocking life's potential.
SonoScape, unlocking life's potential.